If you've been worried about how to document sensitive or politically charged topics, you are not alone. I've gotten so many questions from mental health therapists about this, and that is why a while back I did a full YouTube live stream that was like an hour and a half long where we talked about how do you document really sensitive or politically charged topics in your progress notes. So this video is a snippet from that where I talk about general recommendations for how to manage sensitive topics in your documentation. I go into informed consent and how that relates to progress notes more than intake, and we do a little bit of a reality check and look at what are the potential worst case scenarios, and so how can we plan ahead for those. So let's dive in.
Number one here, I'm nervous about assessments and biopsychosocials. How much detail can we leave off of these and still have insurance cover services? So again, I would look at why are you nervous about assessments and biopsychosocials, right? Assessments and biopsychosocials are not they are not meant to be for insurance. They are meant to be something we all do regardless, right? So we would be doing that regardless of whether or not we created a diagnosis and billed insurance. Everyone does varying levels of detail with assessments and biopsychosocials. It's not something you have to all do in the first session. You don't have to do it right away. I would encourage you, related to this topic, to check out a book by Dr. Daryl Chow called The First Kiss. I will link to that in the description later. It's a great book about the intake process and about rethinking the intake process and making it focused again on the connection with the client. I do think you can do that while still fulfilling insurance requirements. So if you do work with insurance, yes, you need to include enough information to justify a diagnosis. That is the foundational piece of all insurance billing, and you must do that. I would also argue that if you have a client that meets criteria for a diagnosis, that is also good clinical care to do that. And here again is where we go back to informed consent. If you're concerned about that, that is not your decision to make. That is your client's decision to make. So ask your client, tell your client, I want to make sure you know, if you bill to insurance, I will have to give you a mental health diagnosis, and that will be in your record, and your insurance company can access those records at any point if they are paying for this service. That's if you do a super bill or not, right? And so let the client know. And if the client says, sure, that's fine, I don't mind, I would like to know, let the client know what their diagnosis is. Talk with them about it if they have questions. These are all very relevant clinical issues. But I see no reason for avoiding mental health diagnoses or, trying to fib or work around that. Include the information that is necessary for that diagnosis. And yes, sometimes that information relates to trauma if the diagnosis is PTSD. It does not mean you have to include all of the nitty-gritty details of someone's sexual trauma that they experienced as a child, but you do need to include that piece of information. For example, that they were sexually abused as a child. That might be very, very relevant to the diagnosis. So always remember that there are other people and other reasons for documentation, and that kind of goes into our next question. So I will go there. What are your recommendations for making documentation meaningful? Meaning that I can remember it and build off of the information while also protecting clients. This person uses therapy notes, and they're wondering if having a vague note in the progress notes and creating a second psychotherapy note would be helpful. I don't really want to get into having two sets of notes, but I want to protect the client. My notes are way too long and detailed, and it takes me forever. It's hard to write for the client's record, for future providers, for insurance, for me, and for the government, all in the same note, and spend way too much time. So I'm sure many of you are familiar with this, managing all the things and all the people. Okay, so number one, let's talk about, remember that your documentation is not meant necessarily to protect clients. Your documentation is meant to document what happened. And when we get into picking and choosing a lot around that, then we can get ourselves in trouble. And so we do not want to focus solely on picking and choosing from every session what may or may not help our clients. Because here's the deal. Regardless of what you believe and what might be happening in the moment, it is nearly impossible for you to predict what might help or harm them when you start getting into that nuance of adjusting factual information. So really you want to stick with what happened, this presented, and think about what literally can you see, feel, hear. Those are the types of information that you want to stick with. And then when it comes to client process, expression, you can go into a little bit more detail there. You do not have to go into detail about trauma narratives, I think is one of the things that most people are concerned about. We will talk about transgender as a whole other issue after this. So I think that's one where people can get into a little more nuance. So the issue of having a second set of psychotherapy notes, I really wanted to address this. Thank you for asking this question. That does not protect your client or you. So HIPAA gives special protections to psychotherapy notes, which we often call process notes. HIPAA does that as a federal law. I would say trends that we are seeing are towards deregulation, not more regulation, right? So from a federal perspective. So let's not focus on that and instead focus on what is your state law, because your state law usually is going to override HIPAA. HIPAA is the bare minimum for privacy and protection. Your state law almost always goes above and beyond. And not also privacy and protection. There is access. Access is half of HIPAA. It is a key part of HIPAA. And we often focus more on the privacy and protection part of it. That is important. But client access, meaning I get to access my own records, is half of HIPAA. It is half of the purpose of HIPAA. So when we look at it from that perspective, a lot of states say that, yes, you can have these separate psychotherapy notes. HIPAA has this whole definition of what you need to do for them to be categorized as such. And we still say that is related to that person's care, and that person has access to any documentation related to their own care. So do not use psychotherapy notes as a way to protect information. That is a really common way that a lot of therapists become very surprised in a negative way. So also, psychotherapy notes might be protected under HIPAA. That does not mean they are protected against subpoena, right? Nothing is protected against subpoena. We can subpoena whatever. A judge could always override that in a court case. And so you could do the whole, I'm asserting my privilege and I don't think these psychotherapy notes should be released. And a judge might agree with that. But your psychotherapy notes can absolutely be subpoenaed. So it does not protect them from that. And many state laws would actually just override that altogether and say, absolutely, clients have a right to those notes because it is about their care, their health care. So do not write 2 sets of progress notes with the intention of hiding information. Really, and even if you do find psychotherapy notes to be helpful or process notes to be helpful, you should consider what you're putting in those notes and who might access them and the fact that they are not protected from subpoena. So do remember that when you're writing those notes. Okay, then as far as thinking about all of the different people, right? This person mentioned future providers, insurance, me, the government, all in the same note. This is where I would say, yes, all of those parties potentially could access client information, potentially could read a progress note. How likely is that? When we look at what is likely, what is worth these large entities' money to seek access to your client's information, often it is not, right? Or for insurance, it's going to be related to medical necessity. They really don't care about the personal story of the client. That's just the reality. They are interested in, is this person getting better? Do we need to keep paying for this service? That's what they're looking at. And so from that perspective, they do want people to get better. They do want people to improve and have fewer stressors, et cetera. But it needs to be related to that diagnosis. So for insurance, that's fairly simple. There are lots of resources I have on that. I would focus more on you, what is helpful for you, because that's something only you can answer. There might be some odd thing that you like to say. People tell me, oh, I have this way of phrasing things with clients at the beginning of session, at the end of session. We always start off sessions this way and end sessions this way. And that's really awesome. And if you find that helpful to track that information, put that in your note. Anything that you find helpful to track, put it in your note. And then the key there is always default to letting your clients know that. Make sure your clients are aware of what goes in their progress notes, what goes in their assessments, what goes in their treatment plans. And if they have concerns, that they can talk to you about it. That's really the most important thing. All right, then someone said, should we avoid documenting if a client is experiencing stress, trauma, etc., due to sociopolitical climate or government policies? And this is, I should have included this in the information at the beginning. All of my answers are always, it depends. So this will depend. And always default to your own clinical judgment, your own professional judgment. That is really key. So you're watching something like this because you want to get information from, someone who is an expert in a topic area. I'm giving you that information, and you know your clients best and you know that particular situation. And so incorporate my advice and opinions as a piece of information and guidance, and then do what is best for you and your clients. Okay. But more specifically, to answer this question, I think it's okay to include that someone is experiencing stress or trauma around, I probably wouldn't use the phrase political climate. I might use the phrase government policies if it relates to them specifically, right? There's being concerned about what's going on in the world, and there's being concerned about what is changing policy-wise. And then there is this policy changed and now I'm fired, right? That's a very different result. But I would say, talk about someone's stress or trauma or distress, related to changing policies, related to confusion about policies, related to whatever that might be. I think it's perfectly acceptable to say that. And we have to remind ourselves that that is something that people experience every election period. Do I personally feel this is a little different than usual? Yes, I do. And I also acknowledge that every single time there's an election, people are distressed, people are concerned. Every time a law changes, one way or the other, there are people who will be impacted. There are people who will be distressed. And it's okay to include that information in your progress notes. And the way that you worded it actually is very vague. You don't have to go beyond that. You could just say that the client brought up, stress around how government policies have impacted their work or something like that. Or how they are concerned about how they might impact a certain aspect of their life. That's very real and makes sense to include, I think, if it's something that is distressing to the point that someone is talking to you about it. And you can always go back to, if you're working with insurance, does this relate to the treatment goals and the diagnosis? If it has absolutely nothing to do with either of those, and you talked about other things, then you could leave this information out, because it might be relevant if it keeps coming up in the long term. But if it's a one-off thing, and you also talked about, for example, their anxiety and how it showed up in a social setting, then I would focus on that, because that is likely more related to the treatment goals and the diagnosis you have. So always, use that lens first, rather than we can get very, it's very easy, as we ourselves are stressed about things, to then focus in on one particular aspect of a therapy session, rather than taking a step back and looking at it again in the context of how would I always recommend you write a progress note? Always look at the diagnosis and symptoms and look at the treatment goals. And what did you do today in that session to address those things? And if you didn't do anything to address those things, that's okay. You just don't want to do that 10 weeks in a row while you're billing insurance, okay? All right, so next question. I work with an agency that has an EHR system that allows non-clinical staff, so people like an intake coordinator, outreach specialist, data person, case manager, etc., access to clients' assessments, treatment plans, and progress notes. Is this breaking HIPAA? So I added this question in the sensitive information section because this is a process that has been going on in forever, like ever since agencies have existed. So as far as I'm aware, this is not a new concern. And it's not actually related to HIPAA, but I can see how people might be more concerned about who is accessing information now, if you are in general concerned about that. So is this breaking HIPAA? Absolutely not. HIPAA has to do with healthcare information and anyone who is involved in that person's healthcare. HIPAA gives, again, that special protection to psychotherapy notes, which are process notes, which should have nothing to do with anything that relates to being necessary for treatment. So it's supposed to be the therapist, just random personal musings, essentially, or ideas. And so it is absolutely not breaking HIPAA for people involved in that client's care, which sometimes is going to be an outreach specialist, which sometimes will be a data person who's looking at billing, which sometimes will be a receptionist who is helping with scheduling and needs to answer people's questions or update forms and things like that. This is a very common practice. And within HIPAA, HIPAA gives very general frameworks that are scalable, as we talked about earlier, for individuals as well as large entities to follow for privacy practices. And one of those things is if you are a larger entity that is going to have all of these different types of people accessing records, then they are also supposed to scale that access to the records. So for example, someone who's an administrator, someone who's a clinical director might have access to all the clients, whereas a case manager should only have access to their clients. A therapist should only have access to their clients, right? Likewise, multiple people might need to access all clients, like someone who is an intake coordinator or someone who's a data person, but they don't need to access every aspect of the client's record usually. And so that's why these, when you work at agencies or hospitals or bigger settings, they often have very robust and sometimes complicated electronic health records because it is offering these different levels of access to information. So it should be set up that, typically a data person, there are often multiple roles, potential roles within an electronic health record. And so a data person might have access to all the clients, but a very small portion of client data, whereas a therapist might have access to pretty much the whole record, but only of a small number of clients, right? So that is totally within HIPAA and okay. And if it's something you're concerned about, especially if it's something that that you notice is being abused or misused in any way, then talk with leadership at that agency about that and ask them their recommendations.